Go ahead. You want to say hi to everybody?
Hello, everybody. My name's Louis. I had surgery September 13th of 07, and I started off at 328 pounds. This is 2 days after surgery. By the way, don't go play in a poker tournament 2 days after surgery, because 2 days later you get nausea for 2 days. I overdid it a little bit. This was climbing Mount Charleston. This is 90 pounds less. It was about 5 months after my surgery. And I'm down 137 pounds as of today. So I'd like to say thanks to Dr. Rutledge again for helping me out, and had no complications with the exception of no side effects or complications with the exception of a little bit of nausea, but that was my fault. I overdid it, I'm sure. But it's 2 days, no big deal.
And the other thing I like to talk about Louis is a respiratory therapist who works at our hospital sometimes.
Yes.
And so those of you who have a medical background, we invite you to come and watch the surgery. So we invited Louis. We said, come and watch.
Saw several.
My bias is if I were going to, kind of put my life in somebody's hands, put my hands in somebody's life. That's what I do. I would want to see how they did. And so one of the nice things is that we feel real confident about our results. Not a lot of surgeons, Nancy, invite future patients, and so we really feel good about that. Of course, the world's kind of a new place. In the olden days, we never would have brought cameras into the OR, and now a lot of places are, showing live broadcasts from the OR, and it's something actually we're discussing with the hospital. But so we did have Louis in, and we were flattered that he felt that we did a good job. And
it was fantastic. The first surgery we saw, I did two that day with you, and the first one was a lap band removal that didn't work, and then the MGB on that person. And I made the same comment that Tracy made to you. I saw just a couple little drops of blood. I mean, there's no suction used on this surgery. Well, there was no suction needed on any of the surgeries that I watched.
So what he's referring to is most doctors, if you've ever seen surgery on TV, remember that? That's because there's bleeding. And in a perfect world, you don't want bleeding, because that bleeding can cause irritation. It's a measure, roughly, of tissue damage and things like that. And we don't even open the suction canister or the suction tubing for our surgeries. And so it's kind of, again, another kind of measure of the minimally invasive, the decrease in trauma that we try and have. So
that's when I nicknamed you Slick. I mean, it was Slick.
It wasn't at the poker tournament.
Wasn't it? But I eat anything I want. I don't drink too much milk at one time. I can have a bowl of cereal in the morning sometimes. Follow the manual. Do everything it says. Follow it to a T. Your weight will come off. Your sleep apnea goes away. I'm living proof of that. I dream and I sleep at night. Well rested, no headaches. I think I've had 2 or 3 sinus headaches in 15 months. I could have 3 headaches a day when I had sleep apnea. So no more of that. Just like I said, follow his manual. He's got it written down perfect. Do what he says. The weight will come off. You'll feel great. Extend your life expectancy. I think mine went up 12 years after I lost all this weight. It was fantastic.
Any questions from those of you who are about to have surgery or had surgery this past week? Anything from an old, I don't know, it's not appropriate to say old veteran, is it? Yes, sir.
Louis, in that, what'd you say, 5 months, 90 pounds, how much did you lose in that? I mean, what came off in that 5 months? I
lost 30, I think, in the first month.
30, okay.
It might not have been exactly 5 months. I didn't document it well because I work a lot, and I'm available 7 days a week. So I didn't document with pictures or words the loss very well, but it was coming off so fast. I was excited.
So it was fun.
Oh, it was fun.
And roughly the numbers on it, he's told you a couple of data points, but they match what we see. Our average person weighs 300 pounds. Our average weight loss at 1 month, as he said, is 30 pounds. He's right on target. Our average weight loss at 3 months is 50 pounds. At 6 months is 80 pounds for a 300-pound person. So if he was 5 months at 90 pounds, he's just close to about where he should be. And at the end of 1 year, on average, it's 140 pounds, and you're 137.
137, and
It's like you read the manual.
oh, I have the manual everywhere. There's one in my truck. There's one in a couple different bathrooms in my house. So when you're in the library, you want something to read. Read the manual. I still read. I refer to it all the time.
But I think it's interesting. I mean, here his numbers are exactly what the average are.
Yeah.
And not everybody meets that. Some people lose more and some less. But I think that is a good indication of the numbers you're supposed to see. If you were to plot it on a graph, weight loss follows a logarithmic decline. Okay, logarithmic means a whole bunch initially, and then it slows down and then stabilizes, like you're going to bring a jet in for a landing. You drop a lot, come down, get close, and then bring it in slowly and easily for a landing. And that's what we see in our patients. And I told you those numbers are the averages, and here's the person who tells you his home story was exactly the same as that average. Now, not everybody gets average. We see different people lose different amounts, but that's the idea.
But do like the book says, even pre-surgery, I went on salad and soup for a week, and I dropped 8 pounds. I was 328, but I think I weighed in around 320 the day of surgery, just because I ate soup and salad, because he said that it would, you don't want to stretch your stomach out, and what he's going to work on makes for a better surgery. So follow it exactly, and the weight will come off.
Well, Louis, do you have to get off to work?
No, I'm fine. I got a couple doctor's appointments. No, I came to visit.
Questions for you?
Sure.
All right.
How did you handle exercise post-op? What have you done?
I've always exercised, even at 328. I'm very active. I ski and hunt and fish, and I even did mountain climbing and stuff like that before. But it's real tough on your knees, and you huff and puff. I was in Steamboat Springs last month. I won't say what I was doing, but I was up, 10,000 feet climbing, and after 3 days, I climbed 600 feet in less than 1/8 of a mile. So that's pretty steep, without huffing and puffing. In 2005, if I was to try to do that, it would have taken me all day to make one climb. I couldn't have made that climb twice a day. Once in the morning, once in the evening.
As an example, patients of ours have gotten into the Army, they're now patients of mine who are in the FBI, gotten through the admission obstacle course. Patients of mine are in the Secret Service. Patients of mine are in the IRS. So, a lot of people have been through, different training courses and things like that, and have been real successful after they've been through surgery. And we feel like you can lift weights, you can do things basically right away. But remember, as Louis and I talk about, you lose a lot of muscle mass during that first 6 months.
Yes.
That's where your body should be burning fat, but it doesn't because your body's not good at burning fat. That's how you got here. So we want to use some things we can to encourage muscle building and to decrease muscle breakdown. And that's where we get into those suggestions about the creatine and the glutamine and the whey protein.
I did my whey protein on the way here. I do my creatine, glutamine every day. You mentioned exercise and working out. I noticed I lost a lot of muscle and it was tough coming back, to where I was before my surgery. I was lifting way more. But remember, if you've done damage to your knees, you're going to lose weight and you're going to feel a lot better, but your knees are still going to be your knees, what you did with all the weight, the damage to your knees. So you got to be careful. But like the supplements, fantastic. Drink a lot of water with the glutamine, with the creatine. Drink a lot of water, and you'll notice a big difference when you go to work out. It does help.
How soon can you start those?
I think I waited like 3 months.
That's a really good question. A lot of people get wound up about this. Okay, Dr. Rutledge, I get a phone call. I'm going to have surgery. I'm really committing. I'm going to do everything. I'm going to follow your advice. I'd like to, should I start taking the supplements and the vitamins now before surgery even? Get ready to start taking them. I go, just wait for a second. Now listen very carefully. My patients are already well nourished.
That's for sure.
Your problem pre-op hasn't been getting that stuff in. So it's all post-op. And you don't need it right away. All of our advice is related to long-term. Nothing is necessary after the surgery. All of it, all the medicines and suggestions, things, they're kind of like icing on the cake for the first days and weeks. The critical thing then is now we want you to live a long and healthy life. And there we know there are some risks. Long term there are risks of low iron and low B12 and ulcers and things like that. And we know how to protect against them, and we know some things to avoid so that you don't get them in the first place. And you can take good care of yourself. You don't have to worry much in the first couple of days. You're full of calories. You're full of vitamins right now. In the days and weeks to come, that's where you can really help. Do you need to start right away? No. Don't worry about it. If you feel like it, you can start anytime. But there is this kind of tension where people say, I need to start those supplements right away, and we really don't think that's necessary.
What about like lifting weights?
You can lift weights immediately if you want to. You can do the laundry, you can do dishes, you can...
Oh, stop.
Help build some of that muscle back quicker?
Yes.
Okay.
Weightlifting, by lifting weights, as you know, when you lift weights, you tear some of the muscle fibers, and it releases an anabolic signal. What your body is doing against our wishes is sending a catabolic signal. It's burning up, eating up some of your muscle. And we don't want it to do that. We want them, in the whole mix of hormones in your body, we want to stimulate the anabolic hormones. And we want to decrease the catabolic hormones. And we can do that, and weightlifting or just exercising. In other words, we don't want you to go crazy on the exercise. In other words, if you've never been to the gym, we don't want you on the day after surgery to be down in the gym for a 6-hour workout.
But literally, you can work out the day after surgery if you're an active person that works out.
Absolutely you can. Now, you might not feel like it. You might feel a little tired. You might have aches or pains. But you can lift weights. The old advice you may have heard in the past is no heavy lifting for 6 weeks. That's a common bit of advice you may have heard for other people or friends or yourself if you've had surgery. And we said that because those patients had an incision which was stitched up with stitches, and if you lift it, you could tear it apart and get a hernia. Well, we really have no incision. We are going to show you in a few minutes on some of our patients. Not everyone. We're going to show some of our patients will take the staples out. You see there is a little cut in the skin. That's not what we worry about. There is a wall of tissue inside of you that keeps the abdomen and its contents from falling on the floor. And that wall is like a tough burlap. It's called fascia. And in that case, it's got fibers, and when we make our access to the abdomen, we go through the fibers with a small plastic tube like this pen, and it's a little bit like putting it through these Venetian blinds. We kind of sneak between them, and when we come out, that tough wall, that burlap, remains about as strong as we left it. So you can lift weights right away. That's the bottom line. And we have many of our patients who go back to work within a couple of days. Trish, who works with me, when she had surgery on Friday, came back to work on Monday. I gave her the weekend off.
I went back to work right away, but I didn't go to the gym for 3 months. I took at least the 3 months off. I wasn't. I didn't want to.
You could have gone to the gym and done light weights.
Oh yeah.
You could go, like for example, walk on a treadmill. You could do light work. You could do pool work, things like that. But if you wanted to lift, you could lift.
Well, I did do I have a cross trainer at home. I did do that because I loved to cross train. I can do that for an hour a day, even when I was heavy.
I mean, if you want to go for a maximum on your bench press on the day after surgery, maybe not. Yeah.
All right, Louis, question for you and then another question. A patient wants to know if you had pre-op pain and if you have post-op pain.
I had
muscle pain or anything.
I had nothing.
No pain. Okay.
I wanted to work that night.
He did.
You're crazy. Scott is having surgery with us, He says he has arthritis in his back and other back problems and takes pain medication. After surgery, will he be able to take the same pain meds? And after losing a significant amount of weight, will that reduce his pain?
Ask him to hold that until we let Lewis go, and we'll do our other patients, and then we'll answer that. That's a good question. Just remember that. We'll do it later in the morning, because that's a really good question. I've got a really good answer, but I'd like to do it a little bit later in the clinic.
Well,
Lewis, thank you so much.
thank you, sir.
Thanks, Louis.
Thanks.
Guys, thanks a lot. Appreciate it.